If you wanted to pick a country that has been ravaged for decades by economic, political, and physical blows, you couldn't make worse of a choice than looking at Haiti. This was a country that endured autocratic rule for decades by the father and son Duvalier regimes who looted the country and made paupers out of most of the population. Then you add on top of that a 7.0 earthquake in 2010, which was especially apocalyptic because any poor country always has less ability to cope with a natural disaster. Haiti, in fact, is the poorest country in the Western Hemisphere with a per capita income of $756. That's per year. 80% of the people live in poverty, and life expectancy is 63 years old. The corona pandemic has now hit Haitian workers just hard, 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 especially workers who are making a few bucks turning out clothes in garment factories, which was a harsh job, but one that was one of the few stable jobs in the so-called formal economy, meaning a job where you got a paycheck from a specific employer who, in theory, also was paying into healthcare funds to cover your healthcare. Or maybe that employer wasn't paying that money up, as we will now hear from our great guest. Lauren Stewart has been working on Haiti for a decade. She is the Regional Program Director of the Americas at the Solidarity Center. And Lauren, it's almost sad and depressing to focus a story on a country like Haiti that has gone through so much over the past several decades. I mean, as you quite well know, first of all, Haitian workers, the Haitian people, lived 30 years under Duvalier, both the father and then the son, who are essentially dictators, autocratic. They ripped off the country. They stole government money outright. And then you have, most recently, the devastating earthquake in 2010, the 7.0, I think it was, earthquake that just completely destroyed the country and devastated folks. Then you had a follow-up earthquake in 2018. Haiti is the poorest country in the Western Hemisphere, and the per capita income is somewhere around $750, $1,000 a year, I think. You'll correct me on the statistics. And 80% of the people live in poverty. And then you have garment workers who are being exploited terribly in this country. And those garment workers really depend on that job and decent income to basically just try to make it through and not starve, right?
That's right. As you laid out, Haiti has gone through a lot. Haiti has been put through a lot since its inception as a country, the first Black Republic. And so it's been a source of free labor and now a source of very low wage labor for many countries. And the garment sector is primarily a source. The garment sector represents one of the largest, if not the largest beyond the public sector source of formal employment in Haiti. There are about 50,000 workers, the majority of whom are women and often the only wage earners in their families. And they earn incredibly low wages, according to a recent Solidarity Center estimate that we did actually before prices skyrocketed in response to a period of social unrest due to corruption and fuel hikes. We see that the cost of living is 4 times higher than the minimum wage for garment workers. So it's impossible to make ends meet. And now we're at a place where we have the pandemic, right? And so that is having particular ramifications for workers in the sector, not only in terms of putting them at risk of contracting the virus, but we're seeing that their hours have been reduced. And there are some issues with being able to access healthcare, which I hope we can get into a bit more.
Yes, that's going to be the main focus of the conversation. I want to make one other note about the garment industry. It seems like the garment industry is almost head and shoulders among many corporations, multinational corporations along the so-called global supply chain, because in countries all across the world, and the Solidarity Center has been right on this everywhere, in Asia especially, the garment sector, the garment industry really does look for places to exploit workers, whether it be in Bangladesh or Haiti. And frankly, then we as consumers benefit from the exploitation of these workers by the cheap clothing that we wear. And I think that that's important to highlight so people are really aware of that.
That's right. It's a whole system of oppression that's in place, and it's really upsetting for consumers to know that they're, unintentionally participating in that system. And that's why it's really important. The best way to deal with this is to have workers be able to come together to organize and join unions in these countries so that they can improve their working conditions and wages. That really is the key to addressing these issues.
And as you noted, the real context of our conversation is what's happening now in Haiti right now at the time of this pandemic and the mobilization on the part of workers. And I guess one thing that triggered the specific mobilization that we're going to talk about is the death of one worker. Am I right? So tell the story of that, what happened, and then what that has ignited in Haiti.
Sure. It's a very sad story, sad for many reasons. One, possibly because it was preventable. That's the possibility, but also because it's a very common story. So we're just going to hear one today. And it's the story of a 30-year-old garment worker named Sandra Renee. Sandra worked at the Palm Apparel factory on the outskirts of Port-au-Prince for a decade, so a third of her life. Um, Showed up at work, worked hard to produce t-shirts that were shipped internationally, t-shirts that are for a brand that probably all of us have in our closet at home. And um, she fell ill in her 6th month of pregnancy. It was her first pregnancy. And she went to the hospital to seek care. When she arrived at the hospital, she was informed that the employer, the factory, had not paid in to the healthcare system, despite deducting dues from her paycheck for the past 10 years. Now, the insurance system, the acronym that we call it is OFATMA, and it's a autonomous body that's run under the umbrella of the Ministry of Social Affairs and Labor. And this institution is notorious for not only not ensuring that the workers' deductions are paid on time and paid according to the law, but also not providing the best quality care and also having issues with transparency and corruption.
Mm.
And
And
so
and in fact, the let's just highlight this. When money's deducted from an employee's paycheck under that system, similar somewhat to the United States, meaning that there's a contribution from the employee and a contribution from the employer, the money that's deducted from the paycheck of the employee is supposed to then go to this system. And it sounds like, to put not a fine point on it, there's a corruption here. The companies are deducting this money, and what are they doing? Pocketing it?
that's absolutely right. So there are a number of issues that are happening, and they look different, but sometimes it's one thing, sometimes it's a combination. So for the health insurance, a total of 6% of the workers' wages are supposed to be deducted and contributed to OFATMA, which then ensures that workers can seek care at OFATMA affiliated facilities. The worker is responsible for contributing 3%, the employer is responsible for contributing 3%. So what happens is that either the employer has not registered the worker in the OFATMA system, or the employer is deducting the worker's 3% contribution and keeping it for itself and not forwarding it on to the system, or just doesn't make the deductions at all, either for itself as the employer or on behalf of the worker. And so all the while, the worker thinks that these contributions have been made, often because the deductions are being taken, and then they show up at hospitals when they are in need of care and find out that that's not going to happen, because you also have to pay ahead of receiving care in Haiti.
And I assume that this is not an isolated incident. This corruption of whichever way it's happening, based on what you just described, that's rife. It's happening all across the country in the garment industry and probably in other industries too.
Absolutely. I've been working on Haiti for the past 10 years.
Wow.
And yes, and ever since my first trip to Haiti, I've heard from our union partners that this is an issue. This is something that they've been up in arms about, understandably so. It's obviously directly impacting them, their families, and those in their community. Um, and I'm sure it's been an issue long before then, right?
Hmm.
And so it's something that the Solidarity Center has been working with our union partners to organize around, but it's an uphill battle.
And I assume, correct me if I'm wrong here, you're the expert on the country, obviously 10 years working there, then good for you. Is this corruption a legacy of the Duvalier corruption and dictatorship, where you still have in place the civil servants and the people running the country who are basically putting their hands on this money, putting it in their pockets, allying with companies, or is there something new that's happening?
It's hard to say. I believe that OFATMA was created, I believe, in 1995 around. So that would have been, on the end of things. But corruption is a wide scale issue in Haiti and has remained that way. And, one of the things that we talk about with our partners and hear from them is that when workers are struggling day to day to make ends meet, these wages that they're earning are just enough for them to make it through the next day,
Hmm.
right? So it's a real luxury to be able to then like stop from trying to just survive and think about organizing and think about addressing issues of rule of law and how can I strengthen my community, because you're just trying to make it and to feed your family. And so corruption, especially within the public institutions that are tied or that are supposed to benefit workers and their families, are something where unions are looking to address these issues.
And I assume workers just feel sometimes, to your point, exhausted from this challenge. And actually, there's a good analogy. I don't want to really talk about the United States, but the analogy is also true in the U.S., where people say, "Why aren't people out in the streets? Why isn't there a bigger movement?" Well, in fact, most workers, millions of people, are struggling to get by. Again, I don't want to compare it to the desperation Haiti, but when you're working two or three jobs and you're working and just trying to make ends meet, you might have to pick up your kid from childcare. You might not actually have childcare. The idea of activism is very far from your mind. But let's come back to Haiti and let's then pick up the story of this individual, Ms. Renee. And so, what happened then?
Exactly. So she was informed that she actually would not be able to receive care. She was told that it would cost her 70,000 gourds, which is approximately roughly over 600 US dollars. And that would take about probably 4 or 5 months to earn on the job if you're earning minimum wage. And that's if you're not having any other expenses, rent, food, tuition for your children and such. And so it is pretty much out of the realm of possibility for a garment worker to have an extra $600 or $700 on hand. She had a little less than half of that she was able to pull together, and she offered that to the hospital. And I believe that they collected it at the time, but ended up returning it to her because it wasn't the full amount. So she then went to her employer, Palm Apparel, and she asked for a loan against her future wages.
Hmm.
Unfortunately, this is not an unheard of practice. It's often necessary since workers don't earn enough typically to have savings. But the employer declined to do that. And so she ended up dying a couple of days later, very sadly.
And she left, I assume, a family behind, right?
Her parents, for sure. Unfortunately, her unborn baby died as well. And again, this was her first pregnancy that she was really looking forward to. So very tragic story. What's also tragic is that I've heard at least two other stories this month. A story of an asthmatic and also a story of a man who needed dialysis, who also showed up at OFATMA facilities thinking that they were covered because they had had these contributions deducted from their checks. That wasn't the case when they arrived, and both of them died as well.
And again, let's now circle back because we just touched on it. This is especially now exacerbated because of the pandemic. And that makes sense to me because you have a country that already has a rickety healthcare system. I mean, I assume healthcare is very difficult for most workers to get. And it's just a challenge on a regular, quote unquote, good day to make sure that you can get something treated, especially some chronic disease or an emergency. And now you've got the pandemic, which both threatens folks' health, but also is shutting down the industry because, well, we know industries are shut down, especially garment workers throughout the world. All of a sudden, first of all, there's not a demand for their product. And then also there's a concern about having people come to work and spreading the disease. So talk a little bit about that.
You're absolutely right. So the majority of workers, but people in general in Haiti don't have access to decent health care, let alone insurance. Private insurance is, for the 1%, if that. And so garment workers who are supposed to be covered by this OFATMA service can access it at OFATMA related facilities, which again are under resourced. There are many issues, are understaffed, don't always have the treatments or medications that workers need. And so workers are not able to then seek private insurance elsewhere. And again, because you have to pay for treatment ahead of time, they often just go without and sadly die from very preventable illnesses and diseases.
Hmm.
Now, in the context of the pandemic, workers were out of the factories closed in March for 1 month until April, and workers were very much afraid to return when factories reopened. Now, the factories have put in place measures, for instance, for temperature checks and hand washing and social distancing, but you really have to take that with a grain of salt because workers don't have cars, for instance, to get to and from the factories. They have to either walk through incredibly busy marketplaces or take public transportation, which involves like informal buses where
Hmm.
70 or 80 people are crammed in. And so they really risk picking up the virus on the way to and from work and then spreading it once they're there because there are still plenty of people in these industrial parks. And it's very, very easy to transmit. Uh, there aren't great records right now of how many people have been infected. A couple garment workers have come forward and reported that.
And to underscore how little folks make and how desperate people are right now because those jobs are not there, I noted you almost mentioned this kind of in a very subtle way in the document that I read, which was to me jumped out that the standard work week in Haiti is 48 hours. So if I read that correctly, the standard work week is 6 days a week. And then when you are able to have that standard work week, you get paid for one day, for Sunday to be off. So it's arduous. It's really backbreaking work in terms of the schedule on a good day.
That's absolutely right. I'm so glad that you raised that point, Jonathan. And this has really become an issue during the pandemic because what we're seeing and hearing from our union partners on the ground in Haiti is that employers are using the pandemic as an excuse to cut their hours to less than 48 hours a week, right? Now, 48 hours are arduous and there's lots of negotiation and improvements to be done so that that can be reduced maybe to a 40-hour work week and have Saturday and Sunday as paid days of rest. But right now, what we're seeing is employers are cutting workers back to between 3 days a week, which initially was required for social distancing. But now we're seeing them cut it just slightly back to 45 hours per week. So still an exhausting week, but just shy of the 48-hour requirement that you need to be able to earn a paid day of rest. And so workers are, really having a hard time working this really intense schedule, and now they don't have a paid day of rest. So they're earning less, they're at risk of COVID, they often won't have access to healthcare because of the tricks that employers are paying, essentially stealing from them
Mm.
their contributions. And yeah, it's a terrible situation. And we are working very closely with our partners to push back, supporting them in their organizing. Many of them have taken to the streets. In fact, they marched Sandra's casket to the OFATMA offices to protest
Mm.
and to make their very specific demands heard to the OFATMA office. And that's justice for Sandra's family in the form of compensation, but also reforming the OFATMA system and other social security systems in Haiti.
This is capitalism exploitation on steroids. As I said, I've seen this all across the world in the garment industry. So, as we wrap up in the last minute or so, give us a sense now what's the goal? What's the strategy? What are the unions trying to do? I noted that there's been some talk with the government about improving this system, but I guess, again, facing this pandemic, you're trying to undo a deeply corrupt system in a short amount of time to really save lives. So tell us a little bit in short version, what's the strategy now? What's the campaign?
Yeah, so it's a very multi-pronged strategy, right? So making sure that workers know what's going on. They know that their rights are being violated. They know that they are being exploited, but knowing what the law says
Mm.
about that is also really important, and making sure that they are organized uh, within unions. So for instance, we work with two really strong unions right now who are focused on this issue. Sandra's union, which is the Thai ouvrier, and another union in the garment industry that goes by the acronym GOSTRA, and there are a few others as well who are paying attention and organizing. So the education and organizing piece is critical, but also making sure that brands are engaged in helping our union partners to communicate with them what is needed, because brands are also paying the factories in Haiti, um, to pay the wages, but also the contributions on behalf of the workers. So I would imagine that they would be concerned that what they're paying for the compensation package to workers is being kept by the factories. I'd imagine they'd want to know that. But so making sure that brands are engaged, but also making sure that the employers, because it's not hard for employers to forward the contributions that they're
Mm.
deducting, right? Like that does not take systematic change. Redoing social protection systems in Haiti and getting at corruption, those are longer term things.
Mm.
Making sure that the employers are writing that check at the end of every month and forwarding it on to OFATMA, that's something that can be fixed overnight.
Well, call me cynical, but I don't think the brands care one whit what happens to the workers as long as their profits and their bottom line keeps fattening, basically in the backs of the sweat of the brow and, frankly, the deaths of these workers. But good on you for doing all that work, Lauren. And we want to keep track of this, so I want you back on the show to give us an update when there's something to report and discuss. And again, thank you for your work and thanks for being on the show.
Thanks for having me, and I very much look forward to returning and hopefully with good news. But in the meantime, we'll remain in solidarity with our partners and looking forward to circling back. Thank you.